Good afternoon. I am Dr. Manu. I am coming from Kerala, Government Medical College, Kochi. My paper is about the patterns of psychiatric comorbidity in alcohol-dependent male patients in our tertiary hospital in Kochi, in Kerala. The background is the lifetime risk for alcohol-related disorders in male is more than 15%, and the harmful use of alcohol is the third leading factor for disease, disability, and death. We can see in this alcohol is the third leading cause for this disability-adjusted life year loss. And in our state, in Kerala, the usage of alcohol is on a rising pattern. Even though the government has taken much measures to reduce this alcohol use, but still it is on a rising pattern. Very few studies have been done on Kerala regarding this issue. And studies have shown that 66% of alcohol dependence patients have at least one psychiatric comorbidity. And the prevalence of personality disorders in alcohol dependent patients is about 40%, with a maximum of 20% of antisocial personality disorders. Even minimal use of alcohol can cause severe consequences in the treatment of alcohol dependent patients. And the psychiatric comorbidities among alcohol-dependent patients have an effect on the prognosis and treatment of these patients. Hence, it is needed that to study the prevalence of psychiatric comorbidities and personality disorders in such patients for the further care of these patients. So, by addressing these comorbidities, we can get a better treatment adherence, fewer relapses, and a better outcome in these patients. Objective was to study the pattern of psychiatric comorbidity in alcohol dependent patients and to study the association between severity of alcohol dependence and psychiatric comorbidities in these patients. It was a cross-sectional study, and the population was the male patients between 18 to 55 years who fulfill the criteria for alcohol dependence syndrome according to DSM-4. Inclusion 18 to 55 years and those who fulfill the criteria, and exclusion criteria substance use other than tobacco and alcohol. For giving an informed consent. The study duration was for about 1.5 years, and 80 male patients was chosen as per standard formula Z square into 2 PQ by D square. And prevalence was based on the study by Ohra et al. It was about 36.6%. Study tools was used a proforma to elicit details like age, gender, marital status, and pattern of alcohol use. And modified Kupusamy scale was used for assessing the socio-economic status. Short alcohol dependence data questionnaire was used to assess the severity of dependence, and structured clinical interview for DSM SKID 1 and SKID 2 was used to assess the psychiatric comorbidities and personality disorders. In data analysis, we have done proportions, mean, and standard deviations, and also chi-square test was done to find the association. Results are mean age was found out to be 42.4 plus or minus 7.3 in the population, and the majority of the cases of the patients was in the upper middle class. And the mean age of onset of drinking was 20 plus or minus 5.3, and total duration of dependence or daily drinking was about 12.8 plus or minus 6, while mean duration of morning drinking was 6.7, and the average number of standard drinks per day was about 8.6 plus or minus 2.6. And the results of SKID 1, that is psychiatric comorbidities, it was found out to be mainly affective disorders, mainly depression about 7.5%, manic episode 11.3, and hypomanic episode 3.8. Anxiety disorders were also common, with panic disorder 7.5% and generalized anxiety disorder 6.3%. 6.3% patients has also had psychosis, and also found out that psychiatric comorbidities had statistically significant association with severity of alcohol dependence, with a p-value less than 0.05. Next, according to SKID 2, the personality disorders were assessed, and the prevalence was found out to be 22%, with most common being antisocial personality disorders with 16.3%. Other personality disorders found were anxious avoidant, borderline dependent, and obsessive compulsive personality disorders. And personality disorder didn't have any statistically significant association with the severity of alcohol dependence. Discussion part, according to SCID 1, the prevalence in our study was about 43.7, with affective disorders was found out to be the most common one with 22.6%. Certain other studies also had similar results, like Vivek et al. Study got 64%, and Kartukulathil et al. Got 60%, and Aswal et al. Got 54% prevalence of psychiatric disorders. The affective disorders in our study was 22.6. In others, it was about 30 to 28%. And psychotic disorders, 6.3 was our study's ratio, and similar to Aswal et al. And Vohra et al. It was about 4.5 and 4%. Anxiety disorders also 13.8 in our studies, and other studies got 15.8, 10%. The prevalence of psychiatric personality disorders, according to SCID 2, in our study was about 25%, and most common was antisocial personality disorders. And certain other studies also showed similar results, like Morgenstern et al. Got 22.7%, and Singh et al. Got 21% of personality disorders. There was certain limitation in our study, like it was a cross-sectional study and also limited number of sample, so it may limit the generalizability of the study. So the conclusion is there is a high prevalence of personality disorders and psychiatric disorders among alcohol-dependent patients. And psychiatric disorders also got a statistically significant association with the severity of alcohol dependence. So we have to treat these comorbid psychiatric illnesses so as to get a better outcome in the treatment of alcohol dependence patients. And there is a need for further large sample studies on this. So there is a need for further large sample studies on comorbidities and on strategies for identification and management of both alcohol dependence and comorbid psychiatric disorders. The references are here.